Now, I wanted to speak on a particular local issue, because at the same time that the South Australian government is receiving more money than ever before for their hospitals, they're seeing their hospital funding going up by 19%. The response of the South Australian government has been to close hospitals. And this has been particularly felt in my electorate, where they have made a decision to close the iconic Door Park Repatriation General Hospital. This is a 300-bed local hospital. It employs 1,250 staff. The South Australian government are shutting it down, selling the land, walking away and vacating the site. Now, despite what the state government says, everyone knows that this is a cost-cutting exercise. There are currently 300 beds at the Repat. Under the Weatherall government's proposal, when the Repat is closed, 55 rehab beds will be added to the Flinders Medical Centre. So they're taking almost 300 beds out of the southern suburbs. David Pope has said that there are 41 clinical services at Flinders Medical Centre, and they simply at Repat rather, and they simply will not all fit into the Flinders Medical Centre. And I'll give you an example. We have a national bowel cancer screening program. It's a very good program, and we'd like more people to do it. But we have the National Bowel Cancer Screening Program. Now, if you have a positive test, it does require follow-up by colonoscopy. At the moment, the Repat is providing the role of doing the overflow colonoscopies from Flinders Medical Centre. When the Repat is closed, what will happen to that extra work? And this is an important part of the follow-up from the National Bowel Cancer Screening Program. So what we see is a net loss of anywhere between 180 and 250 beds, and that is a big drop in the number of beds. And the opinion of my electorate has been very clear that they would have preferred to have seen the hospital upgraded rather than closed. The Australian Medical Association has warned that other hospitals don't have the capacity to absorb the extra workload because they are already overstretched. So when you look at the fact that hospital funding is going up 19%, there's been a 36% increase in GST funding over the next 5 years, it really does make local residents wonder why the state government hasn't continued to upgrade the site. Because over the last decade, the federal government has given South Australia tens of millions of dollars to fund new facilities at the Repat. For that matter, they've spent some of their own money as well. Most recently, the federal government invested $40.3 million to fund 20 brand new subacute beds at the Repat. These are state-of-the-art facilities. They were only opened last year. And the irony is, within 6 months of them opening, the Health Minister announced that the hospital would be closing, and now those beds and that facility will be sold to the highest bidder. The new fourth-generation rehabilitation clinics, the recent rebuilding of Ward 18, these are very modern facilities at the Repat. The State Labor continually say that this is an old, run-down facility. That is not true. When you walk through, you're amazed by how good the rehab facilities are. There are old buildings there, and many of them are used for office space, not for clinical work. Last year, the Repat provided more than 136,000 outpatient consultations across a broad range of specialist clinics. The clinics treat conditions like heart disease, sleep disorder and arthritis. That equates to more than 2,600 South Australians getting help as a Repat outpatient every week. Also last year, a quarter of all orthopaedic and neurological elective surgery performed in Adelaide was done at the Repat. It also plays a very important role, as I said before, in those overflow colonoscopies from Flinders, which is a critical step in the National Bowel Screening Program. Now, not only has the Commonwealth Government spent tens of millions of dollars at this site, but Flinders University have as well. That is one of the frustrating things about this closure has been that all the partners, the Commonwealth Government, the Flinders University, have been investing significant money at this site. Now, the Repat is a major site for clinical placements for Flinders University students. something like 60% of health science students at Flinders University will rotate through the Repat. Flinders University researchers based at the Repat have attracted more than $75 million in research funding to South Australia. Now, I could go on and on about this, but it is very clear that this is one case where the state government are not interested in the opinion of the local community. I've had listening posts, we've done surveys, and we've run petitions. And it's very clear that my constituents do not want to see the Repat close. More than 80,000 people have signed a petition calling on state Labor to keep the Repat open. So, as I said before, the Repat has seen many upgrades over the last decade, and what everyone else had been working on the basis that we would continue those upgrades rather than shutting down such an important part of our health system.